9 warning signs in your feet that could mean diabetes. It's a common misconception that the only way to detect diabetes is through a blood test. Many people believe that a visit to the doctor, followed by laboratory results, is the sole method of diagnosis. For over 2 decades, as a practicing physician, I've observed this perspective frequently among my patients, and it's understandable why this belief has taken hold. However, what I've learned through extensive experience and what I witness with remarkable regularity is that our bodies often begin sending out signals about elevated blood sugar long before any lab work confirms it. The very first place our bodies tend to communicate these issues is often through our feet. My motivation for creating this video stems from the many individuals I've encountered who have presented at my office, or even worse, at emergency rooms, displaying clear warning signs for months and sometimes even years without recognizing what those signs indicated. My aim today is to equip you with the knowledge to prevent this from happening to you or your loved ones. Just last month, for instance, I met with a 67-year-old retired gentleman who led what he considered a healthy lifestyle and felt perfectly fine. He came in for a routine checkup. Before we even considered any blood work, I inquired about his feet. He casually mentioned that they had been feeling a bit numb for some time, attributing it simply to age. Upon closer examination, he exhibited 4 out of the 9 specific signs I intend to discuss with you today. When his fasting blood sugar was eventually tested, it came back at 214. This indicated that he had been living with diabetes for over 2 years without any awareness. Today, I want to share with you the very same insights I provided to that patient. I'm going to illuminate 9 distinct signs that were present on his feet and are likely present on millions of feet right now, yet are almost universally unrecognized for what they truly signify. For each sign, I will explain the common assumption people make, the underlying physiological process occurring within your body, and a simple daily habit that can act as a protective measure. The American Diabetes Association estimates that a staggering 1 in 5 Americans with diabetes are completely unaware of their condition. This translates to over 8 million individuals unknowingly living with a silent disease that is quietly causing damage to their nerves, kidneys, vision, and, as we'll discuss extensively, their feet. While a relatively inexpensive blood test can indeed detect this condition early, proactive awareness of the subtle cues your body provides is paramount. So, let's delve into these vital indicators, starting with the most common. Sign number 1 is a sensation that nearly every patient I've spoken with has experienced, and more importantly, has consistently explained away. This sensation is tingling, numbness, or that peculiar pins and needles feeling in the feet. My patients often describe it by saying, "Dr. Parker, my foot just falls asleep sometimes. I must have been sitting with my legs crossed." And yes, it's true that this can happen to anyone occasionally. However, my crucial follow-up question is always, is this happening regularly and without any apparent reason? If the answer is yes, then it's imperative that we discuss what might actually be transpiring within your body. Frequent, recurring numbness or tingling in the feet, a condition medically known as peripheral neuropathy, is one of the earliest and most significant indicators that your blood sugar levels have been elevated for an extended period. The excess glucose circulating in your bloodstream begins to wage a slow, insidious attack on the delicate outer protective layer of your nerves. This gradual nature is precisely why so many people overlook it. I often use an analogy with my patients to help them understand this process. Imagine your nerves as analogous to electrical wires. Each wire is encased in a plastic coating, which is essential for the clear and efficient transmission of signals from your brain to your extremities, such as your feet. When your blood sugar levels remain consistently high, it's akin to an acidic substance slowly eroding that protective coating. While the wire can still transmit signals for a while, the clarity of those signals begins to degrade. This degradation, this fuzziness in the signal, is what manifests as the tingling sensation you experience. According to the American Diabetes Association, peripheral neuropathy affects nearly half of all individuals diagnosed with diabetes, making it the single most prevalent complication. Crucially, it almost invariably originates in the feet. This implies that, at this very moment, tens of millions of Americans are likely experiencing this tingling and dismissing it as inconsequential. It is vital that you do not fall into this category. My daily recommendation for any patient over the age of 60 is a modest 20 to 30-minute walk each day. This doesn't require a strenuous jog. A brisk walk is sufficient. Engaging in physical movement is one of the most effective strategies for promoting healthy blood flow to your feet and consequently protecting those vulnerable nerve endings. Furthermore, begin reducing added sugars in your diet today, not tomorrow, but now. Sign number 2 is a symptom that many of my patients describe as the most distressing. This is because it doesn't typically manifest during the busyness of the day, but rather strikes at night when one is alone and trying to sleep, with no distractions to divert attention from the discomfort. Many patients initially attribute this sensation to prolonged standing, the summer heat, or simple fatigue. While these factors can certainly contribute, when a patient tells me their feet feel as though they are on fire, particularly when lying down at night, I take that symptom with the utmost seriousness. A burning sensation in the soles of the feet, especially at night, is a classic and early manifestation of diabetic neuropathy. What is occurring internally is that the nerves in your feet, having been subjected to damage from excess sugar over time, begin to transmit aberrant signals to your brain. Your brain then interprets these signals as heat, even though there is no external source of heat in contact with your foot. Essentially, your nerves are misfiring. Think of it like a fire alarm system equipped with a faulty sensor. The building itself may not be on fire, but the alarm is sounding because the sensor is malfunctioning due to damage. Your nervous system is undergoing a similar process. The burning sensation you feel is not originating from an external source, but from within, from damaged nerve tissue desperately attempting to signal distress. Research published in the esteemed journal Diabetes Care has indicated that burning foot pain is among the very first symptoms reported by patients who are later diagnosed with type 2 diabetes, often appearing 1 to 3 years prior to a formal diagnosis. For this sign, I recommend 2 key habits. Firstly, aim to drink at least 8 glasses of water daily. Proper hydration is crucial for your kidneys to effectively flush out excess glucose and also supports the health of your nerve tissue. Secondly, incorporate more fiber into every meal. This can be achieved by increasing your intake of vegetables, legumes, and oats. Fiber plays a vital role in slowing down the absorption of sugar into your bloodstream, which is precisely what your compromised nerves desperately need to reduce their exposure to damaging glucose. Sign number 3 demands your very close attention, as this is the one that transitions from being merely uncomfortable to becoming genuinely dangerous. This is the sign that most frequently leads patients to seek emergency medical care. They arrive at the hospital explaining, "Dr. Kent, I had a small blister from my shoe about 3 weeks ago, and it still hasn't healed." They have waited, assuming it would resolve on its own. While most minor wounds do heal spontaneously, this is not the case when blood sugar levels are persistently elevated. When blood sugar remains consistently high, your body's natural capacity for efficient healing is significantly compromised. The blood vessels throughout your body, including the minuscule ones in your feet, begin to narrow and lose their elasticity. This stiffening and narrowing impede the delivery of essential components like oxygen, white blood cells, and the nutrients required for tissue repair to reach the wound site in a timely manner. Consequently, the wound remains open, vulnerable, and exceedingly slow to close. Visualize attempting to water a garden with a hose that has a severe kink in it. The water is present, but it cannot reach its intended destination effectively. This is precisely the effect that, high blood sugar has on circulation within your feet. The crucial elements for healing are present in your blood, but they are simply unable to reach the compromised tissue. An open wound that refuses to close is an invitation for infection, a serious and potentially devastating complication. The Centers for Disease Control and Prevention, CDC, reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States, accounting for over 100,000 such procedures annually. Astonishingly, almost all of these amputations were preceded by a minor wound that went unnoticed or was ignored. Therefore, after your bath or shower tonight, take a few moments to meticulously examine both of your feet. Pay close attention to the spaces between each toe and thoroughly inspect your heels. If you discover any cut, blister, or broken skin, gently clean it with mild soap and water. Apply an antiseptic and cover it with a sterile dressing. Crucially, if the wound has not shown any signs of improvement within 48 hours, contact your doctor immediately. Do not wait until next week. 48 hours is the critical time frame. Sign number 4 is something that is often hiding in plain sight, a detail that most people overlook on a daily basis without ever connecting it to blood sugar levels. It is a visible change, something that has been present, yet its association with elevated blood sugar is almost universally missed. Patients often notice their feet developing a darker or more reddish hue, and they tend to explain it away by saying, "I think it's just from sun exposure, or perhaps my skin has always been naturally darker on my ankles." While these explanations may be valid in some instances, there is a distinct pattern of discoloration, particularly around the ankles, that I look for when assessing an individual's risk for elevated blood sugar. When circulation becomes compromised due to high blood sugar, the lower legs and feet do not receive an adequate supply of freshly oxygenated blood. The skin responds to this oxygen deprivation by changing color. You might observe a darkening, a deep red, or even a subtle bluish tint around the ankles. This discoloration is your skin's way of communicating that blood flow to that specific region is insufficient. In some individuals, the skin in these affected areas may also become noticeably thinner and more fragile, another clear indication that the underlying tissue is not receiving the nourishment it requires. I always explain this phenomenon to my patients by likening their blood to a delivery truck responsible for transporting oxygen and essential nutrients throughout the body. Your feet are situated at the very end of the longest delivery route in your entire system, being the furthest part from your heart. When the roads, your blood vessels, become narrower due to the effects of high blood sugar, these vital deliveries begin to arrive late, or not at all. The skin, starved of adequate oxygen, changes its color as a visible distress signal that you can observe with your own eyes if you know what to look for. A study published in the Journal of the American Academy of Dermatology found that these specific skin changes are often detectable, on average, a remarkable 18 months before a formal diabetes diagnosis is made. The recommended daily habit for this sign is quite simple. Engage in 5 minutes of ankle circles, toe raises, and calf stretches every morning. Even this minimal amount of movement can significantly boost blood flow into your feet. Furthermore, if engaging in exercise is challenging, simply elevating your feet slightly while you are seated can make a meaningful difference in improving circulation. Sign number 5 is one that consistently surprises my patients the most, primarily because it appears entirely innocuous. In fact, many people have experienced this for years without ever considering its connection to blood sugar levels. They will often state, "Dr. Kent, my heels crack every winter, it's just dry skin." I hear this sentiment with remarkable frequency. However, when your heels are exhibiting severe cracking in the middle of summer, or when no amount of moisturizer seems to provide any relief, regardless of how liberally it is applied, then the situation is entirely different. Diabetes has a profound impact on the autonomic nervous system, which governs involuntary bodily functions that you don't have to consciously think about. One of these crucial functions is the regulation of moisture and perspiration in the skin. When these autonomic nerves become damaged, the sweat glands in your feet begin to malfunction. As a result, your feet lose their natural moisture from the inside out. No amount of external moisturizing can address the root cause of this dryness. Consider your skin as a protective barrier, a wall that needs to remain intact and sealed. When the autonomic nerves are damaged, it's as though the mortar between the bricks of that wall begins to crumble. This leads to the formation of cracks. These cracks in the skin of your feet are far more than just a cosmetic concern. They represent open portals for bacteria and infection to enter. In a foot that already suffers from compromised circulation, such an infection can escalate to a serious, even life-threatening condition very rapidly. I have encountered patients who presented with heel cracks so deep that they were actively bleeding and who reported having applied moisturizer to them for 2 years with absolutely no improvement. This is not simply a skin issue, it is a clear indication of nerve damage. The American Podiatric Medical Association identifies chronic, difficult-to-treat heel cracking as a significant marker of autonomic neuropathy in older adults, a condition that is directly linked to prolonged periods of elevated blood sugar. An autonomic neuropathy is not a minor inconvenience. It is a serious sign that your nervous system is under considerable stress. To address this, I strongly recommend moisturizing your feet every single night before you go to bed. A high-quality lotion or pure coconut oil can be very effective. Ensure you apply it thoroughly to the soles and heels of your feet, but crucially, avoid applying moisturizer between your toes. Moisture trapped in this area can create an ideal environment for fungal infections to thrive. Additionally, continue to drink your 8 glasses of water daily, as your skin requires adequate hydration from within just as much as from external application. I want to pause here for just a moment. We have now discussed 5 significant warning signs, and I want to pose a direct question to you. Have you observed any of these signs in yourself, or perhaps in someone you care deeply about, a spouse, a parent, a sibling? If the answer is yes, even if it's just one sign, please take a moment right now to go to the comment section below this video and type the word "yes" in capital letters. That's all I need. I meticulously read every single comment posted on this channel. If you have a question, please ask it. If you have a concern, share it with me. That is the very purpose for which I created this channel, not to simply lecture at you, but to engage in a meaningful conversation with you. And if you are finding this information valuable, please consider clicking the like button. It takes only a second and signals to YouTube that this content is useful, prompting it to show this video to more seniors who could benefit from this crucial knowledge. Now let's continue our discussion. Sign number 6 is a symptom that carries more serious implications than most people realize, as it extends beyond just your feet and directly relates to the health of your kidneys. Almost universally, individuals I've seen with this symptom explain it by saying, "I spend all day sitting at my desk," or "I'm on my feet for work." They often acknowledge that occasional swelling due to physical activity is normal. I want to be clear on this point. Occasional swelling is indeed typical. However, if your feet and ankles are consistently swollen and you find deep sock marks imprinted on your skin every evening, then the situation warrants a much closer look. Persistently, high blood sugar levels have a detrimental effect on kidney function. Your kidneys are responsible for regulating your body's fluid balance. When their function is impaired by years of elevated glucose, excess fluid begins to accumulate in the lowest parts of your body, your feet and ankles. This type of swelling, known as edema, is a critical warning sign that your body's filtration system is under significant stress. Imagine your kidneys as the primary filtration plant for your entire body. Every single drop of your blood passes through them to be cleansed. When high blood sugar damages these delicate filters, the entire system can back up, and excess fluid has nowhere to go but downwards, driven by gravity. This fluid then pools in your ankles. If you press your finger into the swollen area and the indentation remains for a few seconds, a phenomenon known as pitting edema, this is not something to be disregarded. The National Kidney Foundation reports that diabetic kidney disease affects approximately 1 in 3 adults with diabetes, and lower extremity edema is very frequently the first discernible sign that kidney function is being compromised. When you are resting, try to elevate your feet slightly above the level of your heart, even just a few inches, by propping them on a pillow. This simple action can help to encourage the accumulated fluid to flow back towards the center of your body. Equally important is reducing your sodium intake. Salt causes your body to retain water, which exacerbates edema significantly. Make it a habit to read food labels carefully. Many canned and processed foods are laden with hidden sodium. And if you experience new, persistent, or worsening swelling, please bring it to your doctor's attention at your earliest convenience. Do not delay, allowing it to potentially develop into a more serious problem. Sign number 7 is a symptom that I observe being most frequently misdiagnosed. Men, in particular, often fall into this trap, and by the time they discover the true nature of their condition, they have often been living with and masking it for years. The majority of my senior patients are male, and what I hear from them, almost without exception, is this: I've been taking ibuprofen for foot pain for months. I just figured it was arthritis or perhaps an old sports injury. I have heard this story dozens of times, and sometimes those initial assumptions are indeed correct. However, in many cases, the origin of the pain is entirely different, and ibuprofen, a pain reliever, will never provide a lasting solution. When nerves are damaged by chronic high blood sugar, they don't always simply become numb. In some instances, they become hyperactive. Instead of going silent, they begin to fire random, intense signals that your brain interprets as severe pain. Patients often describe this sensation as a stabbing pain, an electric shock, or the feeling of a hot needle piercing their foot. This often occurs most intensely at night, when there are fewer sensory distractions to divert attention from the discomfort. Think of a car alarm that has been damaged in a minor collision. Every few minutes, it begins to blare loudly for no apparent reason. No one is attempting to break into the car. The alarm itself is simply malfunctioning. This is precisely what happens with a damaged nerve. It sends alarm signals to your brain when there is no actual external threat or injury occurring. The pain you experience is entirely real, but its source lies in nerve dysfunction, not in physical injury. Taking ibuprofen will not repair a damaged nerve. What it does is mask a crucial signal that your body is desperately trying to send you, and masking these signals is the last thing you want to do when your nerves are clearly indicating they require attention and care. A landmark study published in the New England Journal of Medicine found that painful diabetic neuropathy affects approximately 25% of individuals with diabetes and is frequently misidentified as arthritis, tendinitis, or general age-related joint pain. To help combat this, I recommend 5 minutes of gentle foot and ankle stretching every morning before you even get out of bed. Flex your feet, rotate your ankles in gentle circles, and softly pull your toes towards your shins. This simple routine helps to get your blood flowing before you place any weight on your feet. Additionally, every night before you go to sleep, give your feet a gentle massage with 3 to 5 circular strokes along the sole of your foot and up towards your ankle. Your nerves will undoubtedly appreciate this attention. Sign number 8 is a symptom that tells me how far the condition may have progressed. When I observe this in a patient, I know that the damage is likely not in its early stages. Almost without exception, the patient's initial reaction is, "Doctor, I've had that my whole life." They will say, "I've always had cold feet." They might add, "Dr. Kent, my wife has had to steal the electric blanket every winter for the past 30 years. While I often share a laugh with them, my subsequent question is always, "Are your feet cold even in July?" Are they cold even under 3 blankets? Because it is in those circumstances that my concern becomes significant. Cold feet that persist irrespective of the ambient temperature around you, being cold in the summer, cold even when you're bundled up under heavy blankets, and notably, cold even when the rest of your body feels perfectly warm, are a strong indicator of significantly compromised blood circulation in your lower extremities. Your blood vessels have likely narrowed or stiffened to such an extent that warm, oxygenated blood is simply not reaching the tips of your feet in sufficient volume. Consider your blood vessels as the pipes in a heating system that delivers warmth to every room in your house. When those pipes become constricted or blocked due to damage caused by elevated blood sugar, the heat simply cannot reach the furthest points. Consequently, the room remains cold, no matter how hard the furnace is working. This persistent coldness is not about the weather outside, it is a direct consequence of the condition of your internal pipes. The American Heart Association identifies peripheral artery disease, a condition characterized by narrowed blood vessels, as affecting over 8 million Americans with diabetes, and it stands as the single largest risk factor for this condition. Cold feet are one of its earliest and most consistent symptoms. The most effective countermeasure for this sign is a brisk 30-minute walk every single day. This should not be a leisurely stroll, but rather a purposeful walk involving arm swing. This type of activity actively forces blood circulation into the feet and lower legs, strengthens the walls of your blood vessels, and over time can even help to reverse some of the early stages of narrowing. If a 30-minute walk feels too daunting initially, begin with just 10 minutes. The most critical factor is to start today. Sign number 9 is a sign that is almost never discussed, one that I have never seen featured in any patient brochure, and one that most people, including many medical professionals, overlook. However, once you are aware of it, you will never fail to notice it. I rarely have to bring it up myself because patients seldom notice it on their own, but during a foot examination, when I examine the lower legs and the tops of the feet, I sometimes observe a visible absence of hair in those specific areas. The patient will often look down and remark, "Huh, I never noticed that." And that, precisely, is the problem. It's a subtle sign, easily missed, but it holds significant importance. Hair follicles require a consistent supply of blood and oxygen to function properly. When circulation is significantly impaired by long-standing elevated blood sugar, the follicles in your feet and lower legs gradually cease to receive the necessary nourishment. Over time, they stop producing hair altogether. This loss of hair is a tangible, visible marker of blood vessel damage that has likely been progressing in many instances for years. Think of hair follicles as delicate plants in a garden. When the irrigation pipes supplying water become narrowed or blocked, the plants don't die off immediately. Instead, they gradually cease to grow. This cessation of growth is your body's way of sending a message about the health of your blood vessels, a message you can visually confirm every time you look at your legs. Research published in the journal Diabetes, Obesity, and Metabolism found that hair loss on the lower extremities correlates significantly with peripheral vascular disease in diabetic patients. This is a reliable and frequently overlooked sign for which physicians are specifically trained to screen. Immediately after you finish watching this video, take a moment to examine the hair on your lower legs and the tops of your feet. If the hair is noticeably thinner in these areas compared to the rest of your leg, or entirely absent, please schedule a blood glucose test this week. Not next month, but this week. This test typically costs around $12 at any certified laboratory and is often covered by Medicare. For the vast majority of you, that modest sum can fundamentally alter the trajectory of your health. We have covered a substantial amount of information today, 9 distinct signs, 9 opportunities to detect a potential health issue before it becomes a more serious problem. And I want to be completely honest with you about something deeply challenging in my profession. One of the most difficult aspects of my job is sitting across from a patient who has exhibited every single one of these warning signs for 2 years, yet is only just now discovering the reason why. This isn't due to a lack of care. These individuals care deeply about their well-being. They simply lacked the necessary information. You now possess that information, and I implore you to do just one thing with it. Tonight, before you go to bed, take a moment to sit down and thoroughly examine your feet. Dedicate just 30 seconds. Observe the skin. Look between your toes. Gently feel for any numbness. Check for any wounds that appear unusual or shouldn't be there. 30 seconds is all I am asking, and if you see or feel anything that aligns with the signs we've discussed on this list, please call your doctor tomorrow. Do not wait until next week. Make that call tomorrow, because the earlier this condition is identified, the more effectively it can often be managed, usually through straightforward changes like diet modifications, incorporating a daily walk, and a proactive conversation with your healthcare provider. You have worked hard to build the life you have, your independence, your health, your ability to pursue your passions. Do not allow something as manageable as blood sugar control to diminish any of that simply because you were not informed about what to look for. Now, if you found this information helpful and valuable, please share this video on Facebook right now. Tag someone you care about, a family member, a friend, a neighbor. You might be providing them with knowledge they didn't realize they needed. And if you wish to engage in more conversations like this one, I post a new video every week on this channel, focusing on topics that are critically important for your health after the age of 60. These are the kinds of discussions I have with my patients that are rarely heard outside of a doctor's office. Please subscribe and invite someone you love to join us. I am Dr. Ethan Parker. Stay informed, stay proactive, and most importantly, take excellent care of those feet. I look forward to seeing you in the next video.